Jessica, can you tell us the 5 most frustrating thing about pelvic pain?
Sure. Number one, if you're suffering from chronic pelvic pain, your symptoms can vary widely. So some people who are having pain, their symptoms manifest in different ways than somebody else. And that can make it really hard to, number one, find support and camaraderie to help cope with everything. And it can also make it very hard to find a provider, a doctor, and then articulate some of those symptoms to your doctor. Which brings me kind of to number 2, which is that medications don't always work. So there are lots of medications that can be used to help treat the symptoms, but a lot of times they don't get to the root cause, and then you don't get lasting results from medication alone, which can be very frustrating. And that kind of brings me to number 3, is if the medications alone don't work, you really need a team approach so that you can address the chronic pain from a whole bunch of different angles. So that might include a urologist, a gynecologist, a physical therapist, a nutritionist, an acupuncturist, a holistic doctor, not to overwhelm anybody, but just to know that a lot of times you need to introduce people into your team, for some for short periods of time, some for longer periods of time, in order to help you attain lasting relief. And that kind of brings us to number 4, which is that you don't always look sick. So you're going around and you're trying to find your team and articulate your symptoms, but for some people, like, they can walk just fine, but they really have a hard time sitting. So if you're in a community setting, you might not know that they're suffering. Other people, they can sit okay, but their standing tolerance is really limited. So people cannot understand, well, you're okay, you can sit all day, what's the problem, why can't you go walk down the block? Just little tiny examples. But then if you don't look sick, it can be really hard for your family, your caregivers, your team to understand how much you're really suffering, which can be super frustrating. Which brings us to number 5, and which should actually probably be number 1, and that's that stress can make it worse. So you are in all this discomfort that plays a part in your relationships, your ability to make a living, your enjoyment. A lot of times your diet is modified, and I know these are just small pieces of the puzzle, and then you add stress onto it, and then that makes everything worse, which then makes you more stressed, and you get stuck in this cycle.
That is so interesting, Jessica. Thank you so much. I think this makes people feel like they're not alone and that other people are experiencing this. But the good news is that there are pelvic health physical therapists like us at Pelvicore Rehab who will quarterback your care, and we will not only help you heal physically, we will help you build that community. We'll help you build that tribe of people that you need in your corner to help you. Thank you so much, Jess.